and diabetes mellitus type 2. So client expressed concern on inability to afford current medications. 3, 4, 6, 7. Okay. So here, assessment. According to the body system, neuro patient is oriented. Next is respiration. Crackles throughout the lungs. Crackles throughout the lungs. Cardio S1, S2 and S3. For gastro, vowel sound is normal. Then extremities. Capillary refill time is less than 3, pulse 2 plus in all extremities, +1 pitting edema bilateral. And then the temperature is 98.9 Fahrenheit, pulse 115, respiration 25, BP 149/95, and pulse oximetry is 89%. And now the question number 1 is select top most findings. So what examiner asking here? Top most 4 findings that require immediate follow-up. So guys, please participate, comment your answers in the comment box. Everybody. Then we're gonna break down after this. Once after your answers, we will gonna break down this whole scenario. How we sort out actually the case studies. 3, 4, 6, 7. Okay, yes. So the answer is crackles, respiration, pulse oximetry, and shortness of breath. So these are the answers. Now I'm going to break down how we sort out this whole scenario. It took me 15 minutes to write down this whole. Okay, so now we are going to break down this. So what is the first one? Client overview. This is how you have to follow this when you see your case study in your exam. First, client overview. Make sure you guys write down on your notebooks. Client overview. So what was the client overview? Thank you guys. Please follow my TikTok account for more notes. So client overview here. Number 1, shortness of breath. Number 2, cough. Number 3 is sleep on 2 pillows. Number 4 is nighttime coughing several times. And then fatigue, spending most of the time on bed or chair. Number 6 was anxious. This was the overview for the patient. This is how we're gonna write down the things on our side notes. If you see the case study, then this is the client overview. Shortness of breath, cough, sleep on 2 pillows, nighttime coughing several times, fatigue, spending most of the time on bed or chair, and then anxious. So what was the past medical history here? Number 2. We have to write down, we have to follow the same pattern. Next, past medical history. You will see this whole scenario in your case studies. Past medical history, client overview, social issues, system assessment, this everything. Then past medical history. So what was the past medical history? Hypertension, second, hyperlipidemia, third, chronic stable angina, chronic stable angina, type 2 diabetes. This was the past medical history for the patient. Number 3, what was the social issue? Social issue here, cannot afford medication. Cannot afford medication. So this was the social issue in the case study. So number 4, system assessment. System assessment. Please everybody write down on your notebooks. So what was the system assessment? In the case study, there was crackles throughout the lungs, which suggest fluid overload or pulmonary edema. Next is cardiac. That shows us S1, S2 and S3. So what does S3 means? What does S3 means? Everybody please comment your answer in the comment section. S3, S1, S2, S3. Heart failure. Yes, blessed. S3 means heart failure. Red flag. Red flag. Heart failure, yes. So next, extremities. This is the breakdown of whole scenario. Extremities. One plus bilateral pitting edema. Everybody, please take a screenshot of this. Hope you guys see the scenario. Please take a screenshot of this. After we will discuss the further questions. I think here. Medical emergency. Okay. So now, pitting edema. So this is NCLEX tip. Edema plus crackles plus orthopnea means shortness of breath plus fatigue means is equal to fluid overload. From worsening heart failure. Keep tapping, guys. So what was the immediate findings? Immediate findings was, you guys already answered these questions. Number 1 was crackles. Crackles, sign of pulmonary edema. Sign of pulmonary edema. Number 2 was respiration. Respiration, and that was 25, means respiratory distress. Means respiratory distress. Number 3 was pulse oximetry. Pulse oximetry, that was 89%, means hypoxia. 4th was shortness of breath. So when you see all, like the whole scenario, then you have to break down like this. So now we have to ask some questions to ourselves. I will post this whole lecture on my TikTok account. Just follow my page. So when you're solving the case study, ask themselves, question number 1. Keep tapping, please. Is the patient oxygenating? Oxygenating. So see, pulse oximetry was 89%. So no. The second question, crackles and throw out the lungs, means no. Number 3, shortness of breath, means no. So what was the second question here should be? Number 2, is patient perfusing number 1, tachycardia. tachycardia. That was 115. Means heart working harder. Working harder. Number 2, S3 means heart failure. Number 2 and number 3, edema means poor perfusion or fluid overload. Fluid overload. Then the third question you have to ask yourself, is this an emergency? Question number 3, is this an emergency? So answer is yes. This patient is showing acute decompensated heart failure. So now I'm going to tell you the tips here. Tips. So number 1, crackles plus low oxygen is equal to never normal. Never normal. Always follow up immediately. Number 2, keep tapping this. Number 2, as 3 heart sound in adults is equal to fluid overload. Until proven otherwise. Number 3. Sorry, by mistake. It's okay. Number 3, orthopnea. Means sleeping on 2 pillows left side, heart failure sign. Number 4, never ignore tachypnea. Never ignore tachypnea. Respiration was 25. It means compensation, distress, and hypoxia. So number 5 here. Number 5. Medication affordability. Medication affordability is a huge factor. In rehospitalization. Always follow up on it after the patient is stabilized. After the patient is stabilized. Okay, so now the question number 2 from the case study, you guys have to solve it. I think you already took a screenshot. Just read the scenario and answer the question. Question number 2 here is complete the sentence by choosing from the list of options. The nurse recognized that crackles throughout the lungs due to so the options are ineffective infiltrate. Number 2, collapsed alveoli. Number 3, fluid accumulation. Related related to pneumonia, heart failure, and reduce mobility. Number 3, fluid accumulation blessed. Guys, please keep tapping. Thank you so much. Heart failure, fluid accumulation. 3 and 1. Yes, so the answer is fluid accumulation and heart failure. So the nurse recognized that crackles throughout the lungs due to fluid accumulation related to heart failure. So now we are going to break down this. Good job, guys. Good job. Okay, so left side heart failure, blood, what happened then? Blood backs up, where? Into the, where? Everybody please. Left side heart failure, then blood backs up into the deep Amrit pulmonary lungs. Yes. Then blood backs up into the lungs. Then fluid leaks into alveoli. And then what happened? Then crackles. All clear or all clear? First, what happened? Left side heart failure, then blood backs up into the lungs, then fluid leaks into the alveoli, then crackles. So now we are going to compare here pneumonia and heart failure. Compare pneumonia and heart failure. So number 1, crackles. Number 1, crackles. All clear. Good. Usually localized. But in heart failure, diffuse in all lungs. Then fever, common, rare. Then keep tapping guys. Edema. No. In pneumonia, no. But here, yes. Then S3. Here, no. Yes. Orthopnea. Here, no. Here, yes. Next, question number 3 from the same scenario. Question number 3. If anybody wants to read a case scenario, you guys can take a screenshot of this. Okay, then question number 3. So here, question number 3 from the scenario, the client is at highest risk for developing dash and dash. So options: number 1, sepsis. Number 2, pulmonary embolism. Number 3, respiratory failure. Number 4 is acute kidney injury. Number 1, 2, 3, and 4. Everybody comment your answer in the comment box and keep tapping. Thank you so much, and follow my account. Everybody please comment your answer. Number 3 and 4. Okay, 1 and 4. Blessed. Sepsis and acute kidney injury. 2, 3, I think. No. Why you think? ਸੋਚਣਾ ਨਹੀਂ, ਆਨਸਰ ਦਿਓ ਇੱਦਾਂ ਆਈ ਥਿੰਕ ਨਹੀਂ. ਤੁਸੀਂ ਸਿਨੈਰੀਓ ਪੜ੍ਹਿਆ ਆ, ਤੁਹਾਨੂੰ ਪਤਾ ਆ ਕੇਸ ਸਟੱਡੀ ਕੀ ਆ. Not sure. Okay. Everybody please comment your answer. 1 and 4. 2 and 3. And who else? One more. 3 and 4. Okay. Everybody please comment. I want to know the answer. Aman 1 and 2. 1 and 4. 3 and 4. 2 and 3. Tina. Sukh Sidhu, number 2, pulmonary embolism. Okay. So the answer here is number 3 and number 4. I will break down it. Who said sepsis here? Sepsis. I think sepsis. I'm gonna clear this first. Sepsis. Look at the temperature here. Is there any sign and symptom of infection or temperature, like changes, any changes in temperature? No. So big no to sepsis. Okay, so now I'm going to break down this answers here. Respiratory failure and acute kidney injury. Just write down, guys. Why acute kidney injury first? Anybody? I don't know how to do case studies. Sukh Sidhu. ਤੁਸੀਂ ਸਟਾਰਟਿੰਗ ਤੋਂ ਸੀਗੇ ਲਾਈਕ ਜਦੋਂ ਮੈਂ ਕੇਸ ਸਟੱਡੀ ਸਟਾਰਟ ਕੀਤੀ ਸੀ ਫਲੂਇਡ ਓਵਰਲੋਡ? ਯੈਸ, ਰੀਡ ਕਰ ਲਈ ਕੀਰਤ, ਡੋਂਟ ਵਰੀ। ਆਪਾਂ ਹੁਣ ਇਹ ਸੋਚਿਆ ਕਿ ਮੈਂ ਕੇਸ ਸਟੱਡੀਜ਼ ਹੀ ਕਰੂੰਗੀ ਬਿਕਾਜ਼ ਸਾਰਿਆਂ ਕੋਲ ਮੈਨੂੰ ਲੱਗਦਾ ਸਿਲੇਬਸ ਹੈਗਾ ਆ ਆਲਮੋਸਟ, ਸੋ ਐਵਰੀ ਡੇ ਵੀ ਵਿਲ ਡੂ ਕੇਸ ਸਟੱਡੀਜ਼ maybe. What did you think, guys? Yes, my exam is on Saturday. It's my 3rd attempt. You will pass the exam, don't worry. Okay, I think we have to do case studies in like perfect. Yes, so we will break down every day like the case studies. Yes, the answer is fluid overload. Is it visible, the green color? Is it okay? Fluid overload, case study plus one small topic. ਹਾਂਜੀ, ਜਿੱਦਾਂ ਹੁਣ ਮੈਂ ਅੱਜ ਜਿਹੜੀ ਕੇਸ ਸਟੱਡੀ ਸੀਗੀ ਇਹ ਹਾਰਟ ਫੇਲੀਅਰ ਦੀ ਸੀਗੀ। ਹਾਰਟ ਫੇਲੀਅਰ ਵੀ ਕਲੀਅਰ ਹੋ ਗਿਆ ਤੇ ਕੇਸ ਸਟੱਡੀ ਵੀ ਕਲੀਅਰ ਹੋ ਗਈ ਕਿ ਲਾਈਕ ਕਿੱਦਾਂ ਆਨਸਰ ਚੂਜ਼ ਕਰਨੇ ਆ। ਓਕੇ, ਸੋ ਅਸੀਂ ਇੱਦਾਂ ਕਰਿਆ ਕਰਾਂਗੇ ਕਿ ਲਾਈਕ ਇੱਕ ਟੌਪਿਕ ਜਿੱਦਾਂ ਅੱਜ ਹਾਰਟ ਫੇਲੀਅਰ 'ਤੇ ਕੀਤੀ ਆ, ਕੱਲ੍ਹ ਨੂੰ ਕੋਈ ਹੋਰ ਟੌਪਿਕ ਲੈ ਲਵਾਂਗੇ ਫਿਰ ਉਹਦੇ 'ਤੇ ਕਰਾਂਗੇ। ਮੈਂ ਅੱਜ ਸੋਚਿਆ ਸੀਗਾ ਕਿ ਮੈਂ ABG ਵੀ ਕਰਾਉਣੀ ਆ। ਲੈਟਸ ਸੀ ਇਫ ਆਪਾਂ ਐਵਰੀ ਡੇ ਵੀ ਵਿਲ ਡੂ one case study and the same topic. Yes, so fluid overload plus hypertension. केस स्टडीज ही करो दी। हाँ जी ठीक है, केस स्टडीज ही करांगे प्लस हाइपरटेंशन। both stress the kidney. Write down कर लो please, everybody write down these. So why acute kidney injury was the answer? 1 fluid overload and plus hypertension. I'm gonna show you here the blood pressure 149/95 and then fluid overload in the body that both stress the kidney. So here heart failure, then poor cardiac output, plus poor renal perfusion, and then acute kidney injury, and is one of the major organ failure. This is how it happened. All clear? So question number 1 here, which fail first? Question, and the answer is here number 1, the lungs. Why? Due to fluid backup. Number 2, the kidney. Why? Due to low perfusion. So now we're gonna do